Hi everyone, it's Kellie Cassidy here, clinical psychologist and owner at Cassidy Psychology in Mount Pleasant and Canning Vale. As you can see, I have a special guest with me today for the very first time on one of our vlogs. This is Dr. Rose Stewart, who works here at our Mount Pleasant practice. Rose is a clinical psychologist like myself, and she specialises in the area of perinatal mental health. And given that this week it is Perinatal Mental Health Awareness Week, I thought it would be a great idea to include Rose in our vlog so that she can talk a little bit about what perinatal mental health is and help raise awareness of this really important issue. So if you're not aware, the statistics tell us that maybe up to 100,000 families in Australia are affected by perinatal mental health issues in any given year, which is a huge number of people. And we tend to find, and I'm sure you'd agree, Rose, that it's a really underreported issue, that people don't realise that actually it's an issue and that maybe things that can be done about it. So I wanted to ask Rose a few questions today. And maybe, Rose, we'll start with, can you tell us what perinatal mental health issues actually are and what they might look like?
Yeah, absolutely. So in terms of what we see in the perinatal period, and when we talk about the perinatal period, we mean during pregnancy and generally up to a year or so postnatal. What we commonly see are both depression and anxiety occurring both in pregnancy and the postnatal period. We often also see postnatally symptoms of birth trauma. Women who have found their birth experience very overwhelming and very traumatic. And sometimes that can be of the severity to create symptoms of post-traumatic stress disorder after birth. We sometimes see bonding or attachment difficulties. Women often don't always feel that rush of love that we kind of talk about instantly, and that's okay, and there's support that is in place that can support you with that, with feeling more connected to your baby if it doesn't go as you planned. And there's also a big area of perinatal mental health that is more about adjustment to parenting. It's a really unique time of life that makes a huge change in couples' lives. Whether it's your first child or whether it's your second or third, it still can turn your life upside down a little bit, and there's a period of adjustment that needs to happen, and successfully adjusting to that does not always come naturally to everybody. It can be a struggle, it can be an overwhelming time, and then when you add in hormones and chronic sleep deprivation, it can be hugely overwhelming for not just mums, for dads as well.
Yeah, absolutely. So what sort of things should people be looking out for, either in themselves or in family members, friends, following the birth of a baby, that might kind of indicate that things aren't quite right?
So in general, symptoms of anxiety and depression look quite similar to how they would for someone outside of the perinatal period. We're still talking about the same mental health problems, but what we often see, particularly with anxiety in the perinatal period, is that the anxiety becomes much more linked to the child. There's often a huge sense of responsibility and need to protect this very vulnerable little being that I've brought into the world, and that can often create anxieties around, is my baby safe? Am I able to protect them? Intrusive thoughts, maybe sometimes about something bad happening to my baby and the things I have to do to stop that happening. And in terms of people's moods, there can often be this kind of chronic ongoing I'm not a good enough mum story. And I think whilst I think the I'm not a good enough mum story is pretty common in most new mums, sometimes it can get to the point where it's really overwhelming and it's really affecting your functioning on a day-to-day basis, and it's really taking any enjoyment out of motherhood that you hoped you would get. And I think that's when we start to say this has become a bit more of a problem now, and you might need to be seeking some support. In terms of birth traumas, when we're thinking about support, would be if you're having intrusive memories, images, flashbacks of your birth experience when you don't want them to occur, if you're finding that you're avoiding anything that reminds you of the trauma, or if you're feeling generally kind of on edge, always looking out for danger, easily irritable, those kind of things, then we start to call those trauma symptoms, and that generally needs some kind of intervention to be supported with. In general, I think if you're not sure, the first port of call is talking. You know, if you're worried about a family member or you're worried about yourself, talk to the person closest to you about it and decide between yourselves, is this something we can resolve or is this something we need some professional help for?
Yeah. And I guess it's important for people to realise that you shouldn't just put it down to the baby blues or something like that, which is often talked about, and we can sometimes expect after birth.
Yes.
That this is something bigger than that, isn't it? It's more prolonged.
Yeah, absolutely, yeah. In general, when people talk about baby blues, we're talking about the first sort of 5 days postnatal. It's a short period where women can feel really overwhelmed, really tearful, a bit flat and a bit down. But if it persists beyond that, we're starting to talk about more of a perinatal mental health problem generally. Yeah, so it's different.
Yeah. Okay. So if people kind of have identified, there might be an issue and they feel like they need extra help with it, what sort of things could you suggest?
So I would suggest seeking support through avenues such as online, and if you've got a supportive GP and friends and family in the first instance, self-help, those kind of things. But then beyond that, seeking some therapeutic support, definitely. That can be direct therapy with someone like myself, with a psychologist or a counsellor, or that can be a medication type therapy. Some women feel that this has gone so far that actually they need medication, and you can talk to a specialist in the area to make sure you get something that's safe during pregnancy or safe during breastfeeding.
Yeah, great. And we'll be posting through the week about some of those online support services that are available, most definitely. But I'm wondering, for people who might be thinking about therapy, what might that involve if they were to come and see a psychologist?
Yeah, so my approach for therapy with perinatal mental health problems really focuses on 3 avenues. So I'm considering the mum's mental health and how she's doing. I'm also thinking about the baby's emotional well-being and what we need to be putting in place for them to be having their emotional needs met. And then I'm thinking about the kind of interaction between the two and the relationship between mum and baby and where the most difficulties lie. And I really hold all 3 of those in mind as we go through therapy.
Yeah.
And where the mum feels the problem is, you know, I always work with people based on their goals, what they want to get out of therapy, but also based on my expertise and my knowledge of what I'm seeing in the room in front of me and where I think the difficulties lie and what might help.
Yeah. Okay. So I guess it's about looking at the bigger picture. It's about improving people's functioning and finding the best way that fits with that family to do that.
Yeah, absolutely. And often, I mean, I talk about mums a lot in perinatal mental health, but perinatal mental health problems are now becoming more and more known about in dads as well. So I often like to involve dads in therapy. You know, it's not necessarily just mum and baby coming to therapy or mum on her own coming to therapy. Sometimes the dad comes and the whole family comes, and that's really important because that's your closest support network when you've just had a baby. That's who's there most of the time, and dad is often who's there in the middle of the night when you've both been up for hours and you can't settle your baby, and when you really need to know what's going on for each other and be in tune with each other. And now postnatal depression and anxiety are being diagnosed more and more in men after birth as well. They can also experience symptoms of depression, anxiety themselves in that adjustment phase that comes postnatally.
Great. Okay. Thank you so much for joining me today. I really appreciate your time. I'm going to encourage everyone that watches this video to please share it, because we really want to raise awareness of this really important issue and encourage people to be thinking about this issue when new babies are brought into families, and just be watching out for it, because it's important, I think, to be managing our mental health and not just thinking about the development of babies, but the development of the whole family. So that's about all from us today. As always, here at Cassidy Psychology, we're working together with you to help you flourish and thrive. I look forward to coming to you again next week. Bye for now.